Grids are great for cleaning up that scatter radiation, but it does come at a cost. All right, so we talked about how grids work and how they're constructed, and we're going to talk more about that today. And that is that we've got alternating strips of lead, and we've got an interspace material sandwiched in between those. And the purpose for the grid is to absorb that scatter radiation while allowing as much of the remnant beam that is not scattered, the penetrated X-ray photons that are not scattered, to go through these interspace materials. So we talked about the who developed them, and that is Gustav Bucky. We talked about what their design was supposed to help with, is supposed to help with. We talked about the measures of effectiveness, and really there's two. And between the two, there's really one that stands out, and that is our grid ratio, and that's the ratio of the height of the grid strip to the interspace material in between. Okay, again, you're going to have a tendency to confuse the height of the grid strip with the thickness of the grid strip. You're going to have a tendency to go with maybe the thickness of the grid strip versus the thickness of the interface material. And grid ratio is the ratio between the height of the strip and the thickness of the interface material in between. All right, like the common grid ratios run from 5 to 1 all the way up to 16 to 1. So the higher the first number, the more effective the grid is in absorbing scatter radiation. But we'll see later today that there comes a point of diminishing returns where you can get so effective that increasing grid ratio just a little bit above that to make it a little bit more effective actually comes with such a cost that we don't want to go up to 16 to 1 most of the time. We don't usually want to go down to 5 to 1, but we'll talk about instances where we do. But it's rare that you're going to be working with a 16 to 1 grid. So it's the height of the grid ratio is the height of the grid strip divided by the distance in between, or put out like 5 to 1, 16 to 1, 10 to 1. 8 to 1 and 10 to 1 are usually your more common grid ratios. All right, so the higher the ratio, the grid, the more scatter it cleans up. It absorbs more scatter radiation. It's harder for those scattered photons to get through those little hallways that we talked about before. And what that does is it removes some exposure from the image receptor. It says film, it's an image receptor. So it's going to have an effect on your, not necessarily your visible optical density, but it will have an effect on your index number, right? So if you're working on a system where your index number goes down as you get an increase in exposure and goes up as you get a decrease in exposure, then what you're going to see is an increase in your index number. And if you happen to be working with a system where there's direct correlation, then it's going to go down. So your critical thinking question for the first part of this lecture is what is it that if it removes some exposure to the image receptor, what is it that we need to do to reintroduce those photons to bring our S number back into line with where it needs to be? That is, we got to change something, right?
Increase mass.
Increase mass, and the question is why?
Because you need more numbers to get through.
Exactly, you need more. You lost numbers, so you need to reintroduce numbers. Can you theoretically increase KVP and accomplish the same thing? And the answer is absolutely. But what does KVP create?
Scatter.
More scatter radiation, right? So you get more penetration, but you get an increase in scattered photons. I won't say exponentially, but probably so. We can do the math and figure out exactly where that would come in. But the purpose for the grid is to get rid of scatter, right? So if you increase KVP, you create more scatter radiation, and that's just not a good thing. So we want to compensate by adjusting our mass. And we'll take a look at how much of an adjustment here in a bit. So you got grid ratio. Grid ratio is the height of the grid strip divided by the distance in between. just the definition of your grid ratio. Grid frequency is, just as the name suggests, is how frequent one of these lead strips occurs, okay? So grid frequency is the distance, if you have a grid with an increased grid frequency, you have a decrease in distance in between the grid strips, okay? It's how frequently they occur. And most of your grid frequencies are gonna be a very high number. It's gonna be like a 178 grid strips per centimeter or per inch or something like that. So we talked a little bit about the lacing artifact on Wednesday, no, on Friday, right? And you remember what that was. It was kind of the squiggly lines that you see if you take a picture off your computer. And it occurs because of similarities between the reader and the image receptor in your phone, right? So that was a real problem whenever we first, especially went to CR systems, because as we'll see in the fall semester, our CR systems, they were set up kind of like a TV in that when a CR plate is read, it's read in kind of a raster pattern that goes back and forth across the image receptor. So you got a laser that's going back and forth really, really fast, all right? And that raster pattern that it was reading with was almost identical to our grid frequency in most of our even table buttons. So what we wound up with was a lacing artifact or the moire artifact on pretty much every image that we saw. So we had to get a dissimilarity. So where grid ratio and grid frequency come together is in solving that problem, okay? So grid ratio really is the defining thing in measuring grid effectiveness. And again, most of your grid ratios in your table are probably going to be 10 to 1 grid. Maybe 12 to 1, maybe 8 to 1, probably 10 to 1, okay? So if that is really kind of the ideal grid ratio, let me put a mask on. If that's kind of the ideal grid ratio, we didn't want to lose that grid ratio, but we had the problem with the moire artifact, right? So what they did is, let's say we had a 10 to 1 grid that was this thick, all right? And the interspace material was that far, or the grid strips were that far apart, okay? So what they did was they took our grid and they cut it in half, like so, okay? Now what's that gonna do to grid ratio? The height came down, so if they cut it in half, what's that number suddenly? 5, right? So it's 5 to 1, okay? But we decided that was kind of the ideal, right? So what if then we came back through and we re-entered grid strips in between, okay? So now what happened to the interspace material? So we cut that in half, but we now cut this in half, so it's, well, it was here. Now it's 5 to 1/2. So what is a 5 to 1/2 compared to a 10 to 1? They're identical, right? So what happened there then? Our grid ratio remained the same, but what did I get? An increase in grid frequency. So we can manipulate grid frequency and maintain the same grid ratio and overcome that raster or that moire artifact that we were talking about before. Okay. Now what we saw, and this is just incidental. This is not really much of anything, but where do you put your markers? Generally speaking, when you're doing a KUP, where do you put your marker? On the table, or do you put it on the patient, or do you put it in the bucky itself most of the time?
In the bucky.
Huh?
I put it in the bucky.
In the bucky? Okay, good. Really where you should be putting it, but what happened, back when I was in school, we had these great big fat grids, and there was the distance between the tabletop and the image receptor was greater than what it is now. You're seeing probably some people putting their marker on top of the table or on the patient themselves. Anybody seeing that? Yeah. Well, the reason for that is because, you know, back in the day, what we would do is we'd take the marker and would, you know, reverse the tape and we wrap it around and make it nice and big and fat. And it'd fit on the film and into the bucky quite nicely. Now, with these thinner buckies, what happens in a lot of cases is the bucky eats your marker, right? And I think that's part of the reason is because, you know, we've decreased the distance and made the entire bucky assembly a whole lot thinner than what it used to be. So anyway, grid frequency, number of grid strips in a given space. Grid ratio, again, is the difference between the height and the distance in between the interspace materials.
So more frequency, we have better cleanup.
You have better cleanup with more frequency, but not to the degree that you have better cleanup with a higher grid ratio.
Okay.
Okay? So your main, can't stress this enough, your main measure of grid effectiveness is grid ratio. Secondarily is grid frequency.
Okay.
Okay? Yeah. Thank you. All right, so the interspace material has to be something that is radiolucent. And that is radiolucent compared to lead. All right, so how radiolucent is lead? Not very, right. You put on an apron, and what is it impregnated with? Lead. The window that you look through while you're looking at the patient, what is it impregnated with? Lead. What is the entire room lined with? Lead, right? So x-rays don't get through lead very well. So your interspace material can be a lot of different things. And one of the problems that you run into with grid is that what you've got are strips of lead. All right, so going back to our analogy of the mini blinds. So you open your mini blinds, right? I don't mean raise them, but you open them up where the light comes through them. Does all the light come through the mini blinds?
No.
The answer is no. Why? What does it hit?
It's the blinds.
It hits the blinds, the edge of the blind, right? So just like the shadow of my hand here, not all the light, even though my hand is fairly parallel to the travel of the light, it's going to block some, right? So if we take a grid, which is made of lead and other stuff, and we put those lead strips, even if they're parallel to the travel of the central ray, is it those lead strips going to absorb some of the primary, or really the secondary, but our transmitted photons that aren't scattered? The answer is yeah, they will. So if you took like a magnifying glass and you magnified the image up, what you would see are the grid lines. Can't get past it, you're going to see grid lines. If you have very thin strips that are really close together, they might not be as obvious as very thick strips that are kind of far apart, right? So 8-to-1 grid is probably going to have some thicker strips further apart, might stand out a little bit more, and I think that's part of the reason that we use 10-to-1, thinner 10-to-1, so that we don't see those grid strips quite so well. Now, back to what the material is made out of, and the radiolucency of the interspace material is going to be relative to the radiolucency of lead. We already said the radiolucency of lead is not very high, right? So our interspace material may be made up of a number of different things. It could be paper. All right, so some of your grids are actually made with interspace material being paper. Some of it will be plastic, and sometimes it will actually be aluminum. The problem with paper is that have you ever dropped paper in water? What happens to it?
It falls apart.
Kind of gets crumply, right? So imagine you're working a trauma and you shove a a grid up under a patient and there's a leak in the covering of the grid and it gets down inside of the grid, what are you gonna have? If it's paper, if the interspace material is paper, you're gonna have a messed up grid, right? Hydrostatic pressure is it's an incredible force, all right? You ever seen a retaining wall blowout or something like that, or a dam burst or something like that? If something absorbs enough water, water doesn't compress, and I think we talked about that last semester in physics. Water doesn't compress, so it's gonna push something out. So you get water or any kind of fluid down into your grid, and you've got a interspace material that absorbs water, and it's gonna distort your grid lines. Instead of your grid lines being like this, they're gonna curve and they're gonna warp, okay? So you got this chunk of lead or all these pieces of lead inside that are no longer like this, but they're like this, right? That's not a good thing. So the paper or any kind of interspace material that absorbs water is really preferred not to be your interspace material. Aluminum, though, is what a lot of grids are made with. Now, is aluminum radiopaque? Yeah, it's a little bit, but is it as radiopaque as lead?
No.
The answer is no. Okay, so aluminum is going to be one of the interspace materials, and the benefit to aluminum is it's not going to absorb any kind of water, and it's more similar in atomic number to lead than what paper would be, okay? So would the aluminum absorb some scattered radiation that might make it through the lead strips?
Yes.
Yeah, so you got a couple of benefits there, but if aluminum is more radiopaque than the other materials, then what are you gonna have to do in,
Increase your mass.
yeah, you're gonna have to increase your mass again. So if you increase your mass again, the patient dose goes up. So it's not ideal for patient dose, but for construction of the grid and to minimize the effects of those grid strips, the similarity, the closer similarity between aluminum and lead in those interspace materials and the grid strips makes the grid lines not be as obvious. Does that kind of make sense? So aluminum is used a lot. Plastic fiber is used as well. Okay, so technique compensation is always going to be mass. KVP creates scatter radiation. We want to clean up scatter radiation, so it's counterproductive to increase KVP. And as a matter of fact, I think it's table 11-2 in your book, shows, yeah, 11-2. Notice you've got, you've got the grid ratio, no grid, 5-to-1, 8-to-1, 12-to-1, 16-to-1. And then you've got what they call Bucky factors. That Bucky factor represents how much of a change in mass you need to compensate for each one of those. And notice at 70 kVp, your Bucky factor for an 8-to-1 grid is 3, 12-to-1 grid is 3.5, and a 16-to-1 grid is 4. But if you go up to 120 kVp, what's your compensation for 8-to-1?
4.
It's 4, right? Now, why would that be? Well, would it be that the higher the KVP, the more of a change in mass you need in order to compensate for the introduction of that grid?
Because it absorbs more good photons, so you have to increase mass.
Actually, it doesn't absorb more good photons, it absorbs more scatter. With an increase in KVP, it creates, okay.
No,
Again,
no,
I can't see the mouse move. So as you increase KVP, you create more scatter radiation. More scatter radiation available to be absorbed is going to affect how much is absorbed. Does that make sense? So as you increase your KVP, you increase the amount of scatter radiation you create, and with the increase in the amount of scatter radiation, you're going to absorb more scatter, and therefore you need to increase your mass to compensate for it.
So you have
Okay.
to increase your mass whenever it's, because there's a lot of scatter.
Yeah, so if you were to use, let's say your 15% rule, you have a technique, you increase your KVP and you decrease your mass. Your S number between that lower KVP, higher mass technique and the higher KVP lower mass technique, if you don't change, you don't compensate at all within that shift, then your S number should indicate at the higher KVP that your exposure to the image receptor was lower. All right? So now really a deeper critical thinking question is, so we said that at our safer techniques for the patient were lower KVP high mass, higher KVP low mass. High KVP low mass, right? So now you introduce a grid. What's your patient dose going to do? It's going to increase by a factor of, according to that table, anywhere from 3 to 6, right, times the amount of mass. Now, if you increase your KVP and reduce your mass using a grid, is your patient dose going to be better or worse than if you use low KVP high mass with a grid? I'm getting some frowns. Since the effectiveness of the grid goes up with an increase in KVP, is that going to negate the benefits of using high KVP, totally negate the benefits of using a high KVP low mass technique?
No.
The answer is no, it's not. So your dose to the patient is going to go up as you use the higher KVP, but it's not going to go up as much as using the low KVP high mass technique. Does that make sense? So your dose is still going to go up with the higher KVP using the grid, but it's not going to be as dramatic.
So
Okay.
overall, both for whenever you're just doing an extremity and don't have a grid, and when you have a grid, it's still, because what it comes down to the patient dose, it's still better to use high KVP.
It's still better to use high KVP low mass. Exactly. Okay. Now, if grids improve contrast by removing scatter radiation, why don't we use grid on every exam that we do? Why don't we use them on fingers and hands?
But it has to be so thick, it has to be a certain KVP.
What's that?
It has to be so thick.
Has to be so thick, has to be, your KVP has to be a certain, it has to be high enough. Now, but really, why is that? Why is that really?
It's gonna start taking photons that you want to reach that high.
Okay, well, that's one. But how about this? What type of tissue is going to create more scatter radiation?
Soft.
Soft tissue. How much soft tissue do you have in your fingers?
Not much.
Not much, right? So it's not until we get to about knee size or shoulder size that we really need to introduce a grid, because we get to enough soft tissue that we're going to create a lot of scatter radiation. So there's a point of diminishing returns there as well. We can use a grid whenever we're doing extremity work, fingers and hands, but really all that you're going to be doing is adding patient dose. There's no benefit, no true benefit. Is it going to absorb scatter? Yes, but you're not creating enough scatter to really make it all that effective. So, no point using a grid with very thin anatomy and low KVP. All right, so your bucket factors are, no grid is represented by 1, a 5 to 1, 6 to 1 is represented by 2, 8 to 1 is represented by 3, 10 and 12 to 1, a 4, and then 16 to 1 is 5. And these, are pretty much the grid ratios and the bucket factors that we're going to be looking at test-wise. So as far as changing from a low KVP to a high KVP, you need to know the fundamentals of that. The grid becomes more effective with higher KVP, and that your bucket factor would need to be changed accordingly. The higher the KVP, the higher the bucket factor. But you don't necessarily have to memorize that entire chart at this point. Just be familiar with the increase in KVP. It becomes more effective, and you need more of a change. So what these numbers represent is, if you were to make a technique and make an exposure using the technique, and then introduce a grid, that's how much mass you would need to change to compensate for that. So for 8 to 1, let's say you're up on the floor and you're doing a KUB on a patient, your portable grids are 8:1. It should have a stamp on them somewhere that tells you exactly what the grid ratio is. So it's 8:1, and if you're up on the floor and you don't have a grid, let's start with that. You don't have a grid, and you're doing an abdomen on a patient, and it's for the sole purpose of identifying feeding tube placement. Okay? What do you need to see on feeding tube placement? What's that? You just need to see the tube, right? You need to see the tube. You need to see whether or not it's in the main stem bronchus, whether or not it's below the diaphragm, and if it's, looks like it's probably in the stomach. That's really it. So, they need to start the feeding on the patient. You're on the floor to do a KUB for feeding tube placement. They need to start it like right now. You don't have a grid. Is it worth going to the department to get a grid to shoot that KUB? Answer is no. No, it's not. So you go ahead and shoot the KUB for the feeding tube placement without a grid, just so that they can start it, right? Because really for feeding tube placement, you're doing a low chest x-ray, high KUB anyway, and you're looking for something specific. But they see a shadow on that KUB, and they say, I need a clearer image. So now you go down to the floor and you get a grid. Your first technique, let's say, was 80 kVp at 10 mass, just to make it easy, okay? First, without a grid, it was 10 kVp at, 80 kVp at 10 mass. So what's your new mass once you put the grid on it?
We're using the 8:1.
And we're using the 8:1.
30.
It's gonna be 30, right, because your bucket factor is 3. So it's 3 times your mass gives you your new technique, okay? Now some of your questions are gonna get a little bit more complicated than that, and they're gonna say, okay, well, you used 8:1 grid at 30 mass, but you need even more scatter cleanup. So you're gonna use a 16:1 to take a repeat. So how would you solve that problem?
Would you just do it by 2? Because of the 3?
Yeah, no, it's not gonna be quite that simple. But the way that I always found that it was easiest to do would be to break everything down to without a grid, okay? So you use the 8:1 at 30 mass, right? We had 30 mass. So 8:1 at 30 mass, if I removed that grid, what would my new mass be? 10, right. But now I'm gonna change to a 16:1, so what do I need? 50, right, okay?
Okay.
So easiest way for me to do it was always to just, break it down to no grid at all and then multiply by the new grid factor and you've got your new mass, okay? So what if you don't adjust your technique? You expose using 80 kVp at 10 mass and then you introduce a grid. What are you gonna see? It's gonna be too light, right? Or your index number is gonna indicate that you underexposed by a factor of 3. Okay, so if you go from a 3 to a 5 and you don't make that adjustment, what's gonna happen? Same thing. It's gonna be too light or your index number is gonna show that you underexposed. So if you go from a technique using a 8:1 to no grid at all, then what's it gonna show? Overexposure if you didn't adjust your technique, okay? Now, what's happening with each one of those changes in technique? As we changed our technique to introduce an 8:1, what happened to our patient dose? It's up by a factor of 3, right? 16:1 went up by a factor of 5, right? So you're rarely gonna see a 16:1 grid. You may never see one. Be honest with you, I don't know that I've ever seen one. So you might not ever see a 16:1 grid. This is where you're gonna live, between 8 and 12:1 are your most common grid ratios. So you get to 16:1 and you've again reached that point of diminishing returns. Are you gonna absorb more scatter radiation with a 16:1? Yeah, but look at what's happening to your patient dose, right? You're gonna absorb plenty of scatter radiation to make a diagnosis in these areas, especially here. There's just really no point in using the 16:1. Is there a point ever to using a low ratio grid?
Mammo.
Memo? Yeah, memo. Memo would be one. What about in diagnostic? What tissues are more radiosensitive? I don't mean specific tissues, but what type of tissues? Developing or mature? Developing. Who has most developing tissues? Peds, right? So in some of your pediatric hospitals, pediatric clinics, you're not gonna see these ratio grids, you're gonna see these. Okay, 5:1, 6:1, something like that for your pediatric patients, just to reduce the patient dose.
Just to be clear, if we got my thoughts, if we, remove the grid without adjusting that compensation back to normal, we will overexpose.
Yes,
Okay.
will overexpose the image receptor and the patient.
Okay.
So for these
Yeah.
on the test, anytime it's gonna be like Bucky factors, that's
Yeah.
what we're looking for is the mass, the
Right.
changes in the mass, and
Changes
then
in mass.
patient exposure after that.
Yeah.
Okay.
Yeah. All right, so your measure of grid performance is what they call contrast improvement factor. And contrast improvement factor is just a mathematical calculation that is contrast with versus divided by contrast without a grid. So the higher ratio grid, you're gonna have a higher contrast improvement factor. So when we have a improvement factor of 1, that means that there's no improvement at all. So basically you went from 8:1 grid to 8:1 grid, right? There's no improvement at all. So our contrast improvement factor, if it's truly improved, should always be greater than 1. So contrast improvement factor of 2 would mean that our contrast is twice as good as what it was before. So, going back to there, we may be comparing 5:1 to a 10 and 12:1 grid. Okay. So that is our grid performance, our Bucky factor, our grid factor is how we calculate, our changes in technique. All that stuff we talked about, higher KVP, we create more scatter radiation, the grid becomes more effective with higher KVP because we have more scatter available to clean up. So naturally with the increase in KVP, our grid factor, our Bucky factor increases. Fundamentally, we have 3 types of grids. Down here, we're going to have 2 subsets of those types of grids. All right. First off, our easiest one is just parallel grid, and that is where your grid strips are stacked up, kind of like dominoes. You stack up dominoes, you knock them over, and they all fall. Right. Parallel grid means that all of the grid strips are parallel to each other. All right. So they're parallel to each other. Now the blue represents the remnant beam coming through the grid strips. And what you see on a parallel grid is right in the center of the grid, you've got, your hallways are completely filled up. But because your beam diverges, it doesn't come from a large area on the target, it comes from a very small area. And because the beam diverges, it puts the beam not parallel to the grid strips in the periphery. Does that make sense? So the benefit to a parallel grid is it's easy to construct, so they're cheap, and you've got a lot of positioning latitude with them, but the downside is that you're always going to see grid strips. If you look close enough on a parallel grid that's not moving, it's a stationary grid, you're always going to be able to see grid strips, especially in the periphery. And that especially gets worse with low SIDs. So if you decrease the SID, the divergence of the central ray gets worse, and you start to see the grid strips in the periphery. Now when we see those grid strips, especially when we've got a broad swath of our remnant beam cut off, we call that grid cutoff, okay? a lot of different reasons for grid cutoff that we'll look at here in a bit. So focus grid compensates for that. Okay, focus grid has the grid strips where in the center they're very similar to a parallel grid, but the further out they go, the more they spread and they lean, where the top of the grid strip is leaning towards each other. Okay, they're not parallel except for right in the center, but the further out they go, they're parallel in that they go this way, but they're not parallel this way. Okay, so the further out they go, the more they lean. That lean they call canting, C-A-N-T-I-N-G, canting. What you're going to look for on test questions for focus grids are a number of different words. What type of grid strip uses canted, or what type of grid uses canted grid strips? It's focused, right? They're focused because they focus basically on the focal spot, okay? Which means that in the path of the X-ray beams as it diverges. So what happens if we take this that is perfectly parallel to our divergent central ray? What if I take this grid and I move it way down here? It's going to create cutoff, especially in the periphery. Why?
Because it goes through still the middle because it's parallel, but the edges are not.
But the edges is no longer, the grid strips no longer parallel to the divergent central ray. Okay, so that's number two. Parallel to each other, parallel grid. Parallel to the divergent central ray, focused, right? So canted grid strips, parallel to the central ray. Focus, grid focus, is also going to be specific to a focused grid. All right, you're going to have specific distances that you can use a focused grid. It may be 48 to 80 inches, so it's pretty broad. But if you get too close, then the divergence of the central ray doesn't match those canted strips. All right, so the grid strips are not going to be parallel to the divergent central ray, right? So you're going to have grid cutoff if your focus is exceeded in either direction. If you come in too close, if your SID is too close, if your grid focus is 48 to 80 inches and you use an SID that is 30 inches, then your divergent central ray is too broad for your canted grid strips. Does that make sense? You're going to have grid cutoff. If instead you use 100 inches, for whatever reason, you got a 12-foot SID, same thing's going to happen. You're going to have a very limited divergence off of that increased SID, so you're going to have grid cutoff in the periphery in both of those cases. You're going to have grid cutoff in the center? No, you're not going to have any kind of grid cutoff in the center because that's a parallel grid, right? So you don't really have any divergence here, but you're going to have the further out you go on the grid, the more dissimilar the divergence is to the canting of the grid strips, you're going to have grid cutoff in the periphery. Okay? So, some problems with grids, we'll get to these here in a minute. Some problems with these two types of grids is this. All right, so what if you off-center accidentally your X-ray tube on a parallel grid off to one side? What if you're not dead square in the center of that grid? Is that going to be a problem?
Yes.
Is it?
No.
I love it. You give one answer and then, really? No, get the opposite. Is it? Who says yes? Is it going to be a problem on a parallel grid? Who says no? We've got about half and half. The answer is no. It's not going to be a problem because, it might be a problem with cutting off the anatomy, right? But in as much as the grid being parallel to the grid strips, are they? Just right under the X-ray tube and everywhere else, you got divergence and you got grid cutoff anyway, right? So you've got some positioning latitude on a parallel grid. If it's not centered, if the X-ray tube's not centered to the dead square middle of a parallel grid, it's really not all that big of a deal. Okay? But what if our X-ray tube is off-centered on a focus grid?
Yes.
You're gonna have a problem, right? It's gotta be parallel to the middle, the midline, not necessarily the midpoint, but the midline of the grid. Now, in both of these cases, you can angle your central array parallel to the grid strips. In other words, you know, you've got the patient on the table, you can angle the central array towards the feet or towards the head, and you got no problem in both of these cases. If you angle across the patient, though, you got a big problem, right? Because you're angling perpendicular or across the grid strips, and you're gonna have grid cut off all the way across. So you can angle with the longitudinal axis of both of those grids, right? Here's the other problem though, when comparing these two. What if you're on the floor, you're taking a portable abdomen, you pick up your grid and it doesn't have any markings on it. Most of your grids are going to say tube side on them. If you've looked at any of your portable grids and you've seen a sticker that said tube side, you can tell a focus grid from two things. One is it'll say tube side, and secondly, it will have a grid focus, a specific distance that you can use it. Now, the reason it says tube side is, let's say you're on the floor and it doesn't have a sticker that says tube side, and you mistakenly put that grid upside down. Is that going to be a problem?
Yes.
It's going to be a big problem. The only place that you're going to get any kind of density is right here in the center. So your divergent central ray is, you know, if it's upside down, it's going to be going against those grid strips. So you flip that thing around, and the grid strips are going like this compared to the central ray. So you're going to have decent density right in the middle, but you're going to have immediate grid cutoff, and that's your key word, immediate grid cutoff outside of the center of the focus grid. Okay? So there's that. In both of the, well, let me do this. If we flip the parallel grid upside down, we use it upside down, is that going to be a problem?
No.
No, because they're parallel, right? So greater positioning latitude, less grid cutoff, harder to construct, easy to construct, less positioning latitude, but you don't have that problem with grid strips. You don't see grid strips quite so well. It's what you're going to be using most of the time, so your positioning has to be pretty accurate with it. So the things, the keys you're going to be looking for, grid strips parallel to each other, parallel, positioning latitude, easy to construct. Harder to construct, canting of the grid strips, grid focus, meaning multiple SIDs, right? Inverted grid's a problem, inverted grid's no problem, okay? I think that's pretty much it. Everybody okay with these? Okay, so the last group is what you call a crosshatch. A crosshatch is basically two grids stacked on top of each other with the grid strips going perpendicular to each other. So it's as if you took one grid, laid it this way, you took another grid and laid it that way. Okay? The problem with a crosshatch is because the grid strips are going in both directions, you can't angle at all. With these two, you can angle with the longitudinal axis of the grid, right? With this one, you can't angle in any direction. All right? They tend to be very good at scatter cleanup because scatter created, and it you know, if it's going parallel to the grid strips, it can still get through either one of these two, right? Can't get through this one. Great for scatter cleanup, but your patient dose is going to be very high. Your positioning latitude is almost non-existent, especially if you have a focused crosshatch. Okay? With just a crosshatch where there are two parallel grids stacked on top of each other, you can still off-center somewhat, right? You can still put the patient almost anywhere on the grid that you want the patient to be. But with a focused crosshatch, your central ray has to be pinpoint to the dead square center of the grid, otherwise you're going to have grid cut off outside of just that point. Yes?
But, whenever you're talking about the patient latitude, you're still talking about latitude as being possibilities, right? So,
Positioning latitude, yes, is possibilities, yeah.
So you-
Not latitude as in radiographic technique or anything.
so you have more positioning possibilities on a parallel than
Correct.
you do focused, and more on focus than crosshatch?
Yeah.
Okay.
Especially more on focus than a focused crosshatch.
There's no positioning latitude for a focus crosshatch.
Exactly. Yep. All right, so that's pretty much everything we just talked about. Parallel grids, all the strips are parallel, not necessarily parallel to the central array, but parallel to each other. So it absorbs scatter radiation across the short axis. Again, if the scatter radiation is going parallel to those grid strips, it's not going to absorb those, but it's going to absorb going across the short axis, okay? As opposed to a crosshatch absorbs in both directions, the short axis and the long axis. Simplest to manufacture, more cut off in the periphery because they can't end. And it gets worse at short SID, and it has the other thing is that even though you get that cutoff, and even though it gets worse at short SIDs, the focus on a parallel grid is infinite. You can go as far out or as close as you want to with them. So it doesn't have a focus. Focus is specific to a focused grid. Okay. Crosshatch, usually two parallel grids together, can be two crosshatch, absorbs scatter radiation across both axes, much more effective than parallel, has a much higher contrast improvement factor, but also a much higher radiation dose, has little positioning latitude, and allows for no central ray angulation whatsoever. And the focus is difficult to manufacture, designed to minimize grid cutoff. The grid strips coincide with the divergence of the central ray, and specific SIDs have to be used, and that is your focus. Center of the central ray has to be in the center of the grid, has less positioning latitude than parallel, and then focus crosshatch is just a mess. Now, how we overcome, this is the last thing, how we overcome those grid strips is by using what you already know about imaging. And that is, those grid strips are going to be apparent. You may have to magnify the image up in order to visualize them. But how we overcome them in the table, you can't do anything about them on portables, but how we overcome them in the table and the wall bucky is we move the grid. Okay, so the grid moves, and all it does is it just blurs out those grid strips. So that is the Hollis-Potter bucky diaphragm, and it's the moving mechanism, and the purpose for it is to move and blur those grid lines. The faster they move, the more they blur. So if you're making exposures in the department and suddenly you start seeing grid strips, then really only one of two things, or really one of only three things could be the problem. One is sometimes your machine, the detents will be off, right? And in modern machines, if the detent's off, you're probably not going to get exposure. But if you're working with an older machine, maybe your detent's off, and you're not centered to the center of the grid, and it's focused grid. So that's one possibility. You might have exceeded the focus in one direction or the other. That's the second possibility. Most of the time, though, what's going to happen is it's not moving. So reciprocating grids move back and forth, and in a lot of cases you can hear them, right? Oscillating grids kind of go in a circle. In both of those cases, the purpose is to erase those grid lines, right? Just blur those grid strips. So if you're starting to see the grid strips, chances are you've lost your movement in one way or another. So they're prone to mechanical failure. They do increase the OID because you have to have that distance between tabletop and the image receptor in order to make that movement happen. And if the movement is sufficient enough, it can move your image receptor and then introduce motion onto the image receptor. So those are the just graphics of the positioning issues. If you have a off level would seem to indicate that what you've got is exceeding the focus in one direction or the other. That's really a tilted grid is off level. So if you're not centered to the center of a focus grid, you're gonna see grid lines. If you got an inverted grid, it's gonna be very dramatic. And if you're off focus, if you're too short or too far away, then you're gonna see grid lines too. Grid cutoff. That's what all that is. Okay. We talked about most of that, I think. Contrast improvement, 8:1 is usually okay for exposures below 90 kVp, and that's kind of why we tend to use 12, 10:1 in the department, is because most of the time we're going to be, or not most of the time, but a lot of times we're going to exceed that 90 kVp. Any questions? That's a mathematical formulation for technique compensation. New mass is equal to old mass times 2 over from. That's the grid that you're going to divided by the grid that you're going from. Again, I find it easier just to divide and then multiply. It's just quicker and easier for me instead of memorizing, yet another formula. All right. I did put a question in the discussion. Is there anything, Trent won't be in here for about 5 minutes, but is there anything pressing? Okay,
I think we got the same.
no, just about this.
I had a question, but it wasn't about this chapter.
Okay.
We talked about filtration, KVP, and mass, and what all they do to, I guess, like the brim spectrum or something. And you said that filtration affects the minimum or whatever.
Yeah.
But it also affects other things, right?
Yeah, it affects minimum and it affects the height. So it increases, not the numbers, but the energy level of minimum, and it decreases the numbers, so the height comes down, and it pushes the brim spectrum towards the high energy side. So if you increase filtration, let's say you've got one brim spectrum, looks like that, and really the technique doesn't matter. But if you increase filtration, your new brim spectrum is going to look like this. So the peak energy doesn't change, the numbers decrease, the average increases, and the minimum energy takes off, at a later point.
Okay.
So in this one, if your minimum energy was 5, here you've got a minimum energy of maybe 7, right?
Okay.
So if your average here was 1/3, it may be slightly higher than that, pick a fraction.
Okay. Yeah, that
But
makes
it-
sense. So 5 through 8 are going to be on the final